procedure which requires very close monitoring. It's a potentially life-threatening procedure which we do, but if carried out well, most of the times we'll be able to offer good outcomes in the diseases where bone marrow transplant has been known to be successful. So bone marrow transplant is mainly successful in hematological malignancies like blood cancers and many of the recurrent lymphomas where transplants is done, and in rare cases some of the pediatric malignancies which have recurrence have also been shown to be responsive with the bone marrow transplant procedures. The main challenge in bone marrow transplant is to ensure that we give high dose chemotherapies in a safe and in a reliable way. For that to happen, many people do contribute, and during the procedure of transplant, the patients will receive a very high dose chemotherapy, and they will be immunosuppressed, and there will be challenges regarding the treatment of infections, and there is something called mucositis, and other things, complications may arise. The main challenge in treatment of a bone marrow transplant is to manage the complications. So what we do is we follow the infection control practices to last one bit, that is the whole transplant room or the ward where the bone marrow transplant is carried out is an entirely separate unit, and the normal ventilation of the hospital is separate, and the ventilation for the transplant unit is entirely separate, and even the ventilation ducts are separate, and we use something called HEPA filters. They are able to purify the air which is coming into the transplant unit, and this support is required because the patients who are undergoing transplant are very much immunosuppressed. Even if there is a normal microbial organism which we do inhale and exhale on an everyday basis, even if they get such an infection, which can turn out to be a very morbid infection. That is the reason. So in our hospital we have a separate ventilation for the bone marrow transplant unit, and HEPA filter which carries only filtered air, and that is the first line of defense. And then the movement of personnel across the transplant unit is highly guarded. There is a separate key card which will give access to only authorized personnel to enter the transplant ward, which again decreases the infections. And there is a 24-hour ICU backup and constant monitoring of all the patients, and to pick up at the infections at an earlier stage, which helps in controlling the infections and other complications very early. So all the from the point of building the hospital, to the point of building the hospital till we take care of the patient, it involves a lot of people, and we have ensured that all the international protocols have been used while designing the bone marrow transplant unit, and while training the nurses and the other blood bank specialists for the purpose of bone marrow transplants. All of them have been certified, and they have had minimum experience before we take them into the bone marrow team.